So if you've ever wondered what it looks like when we go to intubate someone and put a breathing tube in, I'm going to show you kind of what that looks like and what we see, what anatomical structures we see, and how we position the patient to give us the best direct view to the vocal cords in order to put the breathing tube in. So obviously the first thing that's really important is patient positioning. And what is important about patient positioning is that there are 3 axes that we want to align, like I said, in order to give us that best direct shot to the vocal cords. And that is your oral axis, your laryngeal axis, and your pharyngeal axis. So here's a picture to kind of give you a visual. When you're just laying down flat, you can see how these axes are not in alignment. And then the position that we put the patient in to intubate and put the breathing tube in is called the sniffing position. And you can imagine this as going outside and smelling the fresh morning air. So if I turn sideways, you can kind of see this better. So the sniffing position is when you flex your neck and then you extend your head at the atlanto-occipital joint. And then you can see how that's imagining you're taking a nice big deep breath in. So what this does, and what that picture shows, is it's aligning all of those axes at one intersection so that it gives us the best direct view to the vocal cords. So now when we're doing direct laryngoscopy, or when we're visualizing the vocal cords, you can see in this picture that we can see the epiglottis, which is that flap of tissue that you can see that normally closes whenever you swallow so that nothing goes into your airway or your lungs. And then you can see the vocal cords themselves. And then you can see the corniculate and the cuneiform cartilage as well. So depending on who you ask, some people will say you can see the arytenoids, but according to textbook, you can see the corniculates and the cuneiform cartilages, but the arytenoids lie directly under the corniculates. So the corniculates are the little nodule type looking cartilages that you can see in the picture, and the arytenoids are just underneath that. So the corniculates kind of sit right on top of the arytenoids, and then the cuneiform cartilages are just lateral to that. So then when we put the breathing tube in, we go in and we just put the breathing tube right through the vocal cords. And obviously we can put in different sized tubes for different sized people. So for kids, we would use a smaller tube. For adults, we would use a larger tube, etc., etc. And this picture is in someone that is a normal, healthy individual. There's no edema, there's no secretions, there's no vocal cord paralysis or anything like that. So this is a very good, clear view of what we see when we go to intubate someone. And here I'll show you another picture of just how that looks from the side when we're actually going to put that breathing tube in and where it sits in the trachea. So yeah, that's pretty much what we see when we put a breathing tube in someone. Again, patient positioning is super important to give us the best view and the best direct shot to the vocal cords by aligning those 3 axes and putting the patient in the sniffing position. And yeah, that is all.